Hi, my name is Jess, and this is my video assignment for BCIT's NSPN 7155, the breastfeeding experience. So I'm going to take my breastfeeding issue and work through the clinical decision-making process here, starting with knowledge, going through cues, judgment, decisions, and evaluation of outcomes. So to start off, my health challenge with breastfeeding is flat nipples for the mom and jaundice in the babe. So the way I'm going to start off, so in the knowledge piece, is what do we know about flat nipples, what do we know about jaundice, and then how do we move forward from that. So first of all, flat nipples, this is a pretty bad picture, but I think it gives you the general idea that flat nipples just don't protrude. This is a normal nipple, this is a flat nipple. So they just don't protrude prior to an infant suckling at the breast. Sometimes they will come out after the infant's been suckling, but not always. So the thing about flat nipples is they may or may not present a challenge. It really is very dependent on the person. So before I go into doing an assessment with a mom and babe, I need to know a lot of things about their situation before I go in. What was the delivery like? Is it a first baby, second baby, third baby, onward? Was it a traumatic delivery? Was it a very smooth vaginal delivery? Was it a cesarean section? Was it a booked section? All these things help to hone in the sort of support I'm going to need to do with this mom. The fact that she has flat nipples is not really a concern unless there's a problem with the latch. However, jaundice, as we know, jaundice is the result of high bilirubin levels, which is the product of breaking down the red blood cells. So the liver cannot clear the bilirubin fast enough, and it builds up in the bloodstream, gives them a little bit of a yellow appearance, and can make them really sleepy. So we'll get more into that in a little bit. But essentially knowing that infants don't have a very mature liver can slow that process down even further. Colostrum itself in those early days is a laxative, because one of the things that we know about jaundice is they have to poop it out. So if there is meconium stool still sitting in their colon, they can actually reabsorb the bilirubin that's sitting there. So colostrum acts as a laxative on top of all the other benefits it has to help clear that bilirubin out of the system. So what are some of the cues we have? So flat nipples are something you're going to see and be like, oh look, this woman has flat nipples. So you can, sometimes flat nipples can appear flat and then it turns out they're inverted, which is a different thing, although I think sometimes people use those terms interchangeably. So an inverted nipple is when you would sort of pinch in behind the nipple, hopefully you can see that there, pinch in behind the nipple, and then the nipple piece actually like goes into the breast tissue, whereas a normal nipple, when you squeeze it, kind of protrudes further. But with the flat nipple, it may come out a little bit when you're pushing, or if it's inverted, it will move inwards into the breast tissue, which can be a little bit more challenging for latch, but it's often associated with a connective tissue. Either there could be scarring, or maybe it's just a genetic, the person's born with inverted nipples. There are ways to deal with that. I'm not going to get into that because my challenge is flat nipples, not inverted. So you can do that little pinch test, and if that pinch test results in the nipple staying where it is, then you just work with that. If it's a flat nip, if it's an inverted nipple, you'd have to try and perhaps work it out a little bit through massage. Jaundice, so what are the cues about jaundice? Well, there is a wonderful reference tool that you can find on, I'm guessing most units, our unit has this little chart on the wall, which physicians will look at. There's a blood serum level of bilirubin drawn, and then their hours of life, and it's charted on here in a graph, and it says, oh, they're below this line, they need to be treated. So there's that reference tool. So the testing for it is with bilirubin serum level. So at our hospital, that usually is just a heel prick when they do the PKU test, for example, they also will draw bilirubin at the same time, sometimes if it's necessary. The other reference tool you can use other than this one is called BiliTool, and you can Google it. You just Google BiliTool, it's bilitool.org, and it's got both American and Canadian conversion rates. And you put in the time they're born, the day, and then the time that the bilirubin is pulled, and then put in the result, and it tells you, it guides you as to whether or not that child needs to move forward with treatment. So signs and symptoms. So before you even get to a blood result, the nurse needs to be looking for those signs and symptoms of jaundice. So if you have a baby that's really sleepy at the breast, they're really not interested in feeding all that much, they're having to be woken up for feeds, and even at that, you're having to keep them interested the whole time. Of course, I mentioned that sort of yellowish skin tone. Sometimes it can be a little more orange. Something you need to keep in mind for folks with Oriental heritage sometimes look a bit yellow already, so sometimes that's not a great guideline, but for the standard Caucasian baby, you can kind of see the jaundice in the yellow tone of their skin. But bigger signs really are the sleepiness, and if they're not thriving in those first few days. Sometimes they can have a really high-pitched cry. If their bilirubin gets high enough, it can move into the sclera of their eyes, so that white part of their eye can actually turn yellow as well. So you can, UV light will help that, so if babies are out in sunshine for 10 or 15 minutes, sometimes that's therapeutic, but I don't know really the guidelines for that process. It's not something I would recommend to parents to be like, oh, just take your baby out in the sun for a while, because they could just get a sunburn. Sometimes they have a high-pitched cry. I'm not sure if I mentioned that. If it's severe, it can move into an encephalopathy or a kernicterus. So kernicterus being more convulsion type situation, encephalopathy obviously swelling in the brain. So judgment, before I can move forward, what does this assessment look like with a mom and babe? So I want to be looking at the latch. How well is that baby getting on there? Is the flat nipple creating a problem? Because we're seeing a baby with jaundice, that doesn't normally happen right away in the first day or two. If it is, it's a specific type of jaundice. But if it's, day 3 or day 4, we're seeing it come forward, it changes things. So is the jaw working? Is the baby actually actively sucking and actively swallowing? What do the mom's nipples look like when the baby comes off? Are they flattened out? Meaning maybe the tongue is pushing in the baby the wrong way. Is mom's nipples getting damaged or breakdown? How much of that breast tissue is getting into the baby's mouth so that we can properly assess it? How long is the baby feeding? Are they getting their 8 to 12 feeds in the 24 hours? Do they have pees and poops? Big deal. Is mom offering both breasts or just one breast or the other? So don't really want to get too far into that, but those are the things that I'd be looking for, like in my assessment. And then of course the bilirubin, is it appropriate for their age of life? So decisions, it really is from your assessment, is there a problem with the latch, or is the latch working fine? It's just the baby's, maybe gotten behind on feedings and got into the sleepy state and hasn't been able to recover from that. So mostly what we're going to do is try and improve the latch. We want maybe some hand expression going, pumping, measured feeds possibly of EBM. If the bilirubin level is high enough, they will be put onto a phototherapy. So there's different ways that can look. We have BiliSoft, which is basically like a blanket. It goes right around the baby, so mom can still hold the baby, can still nurse the baby while they're being treated. There's the BiliBed, where the babies lay on it, and they of course have little eye coverings. They lay on the bed, and the light comes from the bottom, and then there's a whole BiliUnit where the light's coming from both sides. And depending on the severity and depending on what works best for that family, will decide which form of phototherapy you're going to be doing. The GP, midwife, pediatrician, whoever it is who's looking after that babe definitely needs to know if you're seeing signs and symptoms of jaundice. They're the ones who are going to order the phototherapy. So my priorities for a mom and babe with this situation are going to be to make sure there's an effective latch, make sure we've got our milk transfer, and reassure the mom and the family that the treatment, about their treatment that they're doing, and that we're choosing the right options for them. So to evaluate whether that's working, well, we're going to see either a standstill or a decrease in that serum bilirubin level. You can't really take one bilirubin level and just say that's it. There would be repeat bilirubin levels. You're going to see an increase in stool, an increase in urine, and with the stool, hopefully you're going to be seeing that move away from the meconium into transitional stool, as the milk supply comes into a standard sort of milk stool, breast milk stool, which has that lovely mustard color. You're going to see a more interest from the babe, activity at the breast. You want to continue to monitor for deterioration at the nipple. You want to continue to monitor for a good latch. And you're going to continue to monitor the infant behavior. I think that's all I really have to say. I could say millions more things about it, but I think that's the quick and dirty of flat nipples and a baby with jaundice. Thanks.